Hello. Well, here I am. What is my superpower, I wonder? Or rather, how did it start? So maybe someone gets a compass as the first thing, and then they start from there. Maybe someone gets a sewing machine. In my case, the thing that I was given was my grandma's hand by an emergency technician, and he told me, hold it still, I need to administer this medication. So I did that, and after that, he praised me, oh, you have a steady hands, you're gonna do great in medical care. And I was thinking, what are you talking about? You know, I like math, I am thinking of computers, electronics, things like that. What medical care? And a few years later, about 20 or so, I find myself doing a ski patrol, volunteering job. And I find myself taking emergency medical classes and emergency medical exams and helping people. And I thought, oh, this was the prophecy apparently. This is why I'm here. A few years moving on, I'm creating all kinds of sensors and gadgets for elderly care, for healthcare. So I'm thinking maybe this is where I am. And then the next thing I see myself is I'm on top of Kilimanjaro and thinking, oh, I should have brought this pulse oximeter with me. Do I really need to go further? The thing would tell me if I should. Once I got back, I thought maybe it's a good thing I didn't have the pulse oximeter. And I started thinking, maybe there's more than just sensing things, measuring things, and giving the proper care. Maybe sometimes there are some things that we should not give to people as an information. That doesn't mean we shouldn't care for them, though. So, but suppose we are in some medical condition, and we're taking some tests, and we're starting to paint a picture of the health of the person. And we get some dots, some pixels in the picture. But these dots, they don't tell us much. So what do? We do some more tests. We get the picture slowly is filling up. And we're trying to make a diagnosis. But what if we do more and more of these tests? Or collect more and more data. And today, with all kinds of sensors, we can do that. Now, all of a sudden, we start seeing the big picture, something completely that we would have avoided otherwise in a bad sense. And maybe that tells us where the core of the problem is, or maybe it tells us some other things. Can we apply this to medical care? Or should we really? Maybe everything is great there. Everything is okay. Well, if we look today, we are a growing population. We are lots of people, and we are getting older and older. And the medical personnel, doctors, nurses, they're just not catching up, they're not scaling up. So we need to do a disruption of sorts. And just another thing to drive the point home is, if we look just in US, according to statistics, there are more than 400,000 preventable adverse effects, things that happen to people that shouldn't happen. And it's not just bad in terms of health, and it's not just lives lost, thousands of lives lost because of that. But it's also a lot of money lost because of that. So, how do we do this? How do we fix? Today, if you search for smartwatch saves life, you actually don't get one hit, you get a lot of hits. And turns out, technology today, simple technology, is helping people of different ages, of 28 or 76. And people are saved just because we have this gadget that monitors the heartbeat, that does some analytics on top of it, and raises an alarm and says, hey, you should go to the doctor. Right? And people go to the doctor. But do we really want to wear something all the time? Continuing a little bit on the subject of smart mattresses, I introduce a dumb mattress, a mattress that I have at home, and a smart gadget that I put under the mattress. And there are things like that already available for people and also for hospitals. You put it under the mattress, and you touch nothing, no sensor other than you would usually touch. You just sleep on the mattress, and it senses for your heartbeat, it senses your breathing rate, your agitation, it does analytics, it figures out what's your sleep pattern, what's your sleep score perhaps, and so on. and it's not just for homes, it's also for hospitals. If you look at the list here, the list is quite long, I'm not going to read it, but the point is there are a lot of positive things that were detected after 6-month trial pilot of early sense device in California Hospital Medical Center, for example. So another saying that you say, okay, what's your problem? Or let's say, what's your medical problem? There's an app for that. It's not just an app, there is a web application for that, there are sensor systems. For example, here you can go to CareSpan and you can get a checkup without leaving your home. You can get an eye exam using just your cell phone or perhaps your computer and order glasses. You can have your heart rate measured and your breathing rate measured using just a pure digital camera or web camera, and there's no need for special device. And again, that can help for remote health, for telehealth. And last but not least, what about washing hands? So there's a company, Hygienix, that is creating these bracelets, and the purpose of bracelets is to monitor what's the compliance of washing hands, how clean they are in a hospital environment. And you might think, okay, what's the big deal? I always wash my hands, you know, especially if I'm a doctor or a nurse. So it turns out that every year in US, there's about 1.7 million infections in hospitals. And some of them are because of this non-compliance, perhaps a large portion. And not just talking about the health of these people getting sick that they shouldn't have, there's also a lot of money lost. For example, if each case costs about $15K, then put together, it comes to about $30 billion. And even only the half of them could be prevented using devices or systems like that. I would say that's worth it. All right, so how do we call all this? For a number of years already, there's this term digital health. And I would say what it is, it's the convergence of digital technologies, of genetic research and achievements with health, with healthcare, with our lives, with the society. Right? And there's a number of benefits for patients, for elderly people, aging at home, being healthy, for families, and also economic incentives for the caregivers and institutions. So let me show you another picture. So let's say we don't have one sensor, we have a lot of sensors in a household. We put them on different rooms, monitoring what's called activities of daily living of a person. So this research study happened to 20 people. 10 of them were healthy, 10 of them had dementia. And what you can see here, there's a pattern on the left for healthy people of doing different kinds of things, watching TV, taking a walk, eating, going to a toilet, when, how many times, and so on. And on the right side, there's a pattern for dementia person. And you can clearly see, even with the naked eye, that there's a considerable difference between the patterns. So we can monitor our activities and we can figure out what is happening with the person. So suppose a person is healthy, right? How do you figure out when he gets something bad? The patterns start to diverge. What we have is so-called circadian rhythms, the things that we do every day. We get up, we go to the shower, we go to the toilet, and we do these things in about the same time, about the same order usually. Once this starts to diverge, there's probably a problem that needs to be addressed. And it's like an alarm. And then we can either call a doctor or we can call a family member and take care of this. So another project is what we call Healthy Walk. So this is happening here in Latvia. And what we are addressing is diabetes patients, specifically diabetes 2 patients. Is this a problem? It's a big problem. So according to International Diabetes Federation, every 1 in 11 adults is a diabetes patient. And moreover, about half of them don't know about this. right? So, and yes, there is medicine how to help with the condition, but it turns out people can help themselves. And what we propose and what we test is when people do interval training, intensive interval training, for example, walking actively for 3 minutes, then calming down for 3 minutes, and walking again for 3 minutes, and so on, doing it about 3 times a week for an hour or so, doing that for about 4 months, turns out there's a positive impact to the health. The glucose level tends to go down if we do it properly. And it's not just about, hey, here's the gadget, you should use it, but also how should we motivate these people? How do you interact with these people? And that's why we have 3 groups. One is the control group, where everyone does it as before. Talk to the doctor tells him how to live, and that's what he does, hopefully. Compliance or non-compliance is a big issue there. The other group is they work with a trainer, with a rehabilitation specialist, and we also measure their heart rate during the trainings. And the third group is they have a virtual trainer, an application that was developed also by one of our graduate students. So we are in the middle of this study right now, but results are promising. And one kind of interesting thing that showed out in early beginning is that people do not really know what they can or what they cannot do in terms of physical activities. So, for example, they are mistaken about aerobic capacity. In other words, if you ask somebody are you physically active? And he says, yes, I am physically active, I'm working out. And then you ask another person, and that person says, no, I'm not really, I'm just couch potato mostly. And then you actually make measurements of how much physical activity can they take, and their body take, in comparison to what they are doing. Turns out sometimes that the person who claims is active, that he can do much more than he's doing, which tells us that either he thinks that he's doing it all, but he's not, or perhaps the other person is not telling us how much he's doing the physical activity. So what's the moral of the story here is that perhaps we can come in with technology and help these people to actually reach their potential, and here the potential is to get healthier. Right. So if we can help one person, how can we help many people? So there's an interesting site, I believe. It's called Cure Together. And what you do on the site is, if you have some experience, you can enter your data. It's not purely medically verified necessarily, but it may give you, given the large amount of data, it may give you an indication what to do if there's a problem. So for example here, how to deal with anxiety, how to deal with depression. And according to this website, it turns out exercise is the best. And what's the next thing is playing with your pets. Right? So this is proven by the crowd, so to say. So that's what I like, that we can participate. And that's also my sort of call to action is, in the puzzle of digital health, I invite all of us to see whether we are the piece in that puzzle or whether we are the facilitator that can put together these pieces. And I'm sure that all of us have this magic power or superpower, either to be a piece and provide the bigger picture of the healthcare, or bring us all to a better life, and especially our kids, of course. So let's do it. Let's deal with the privacy. Privacy, of course, is a big issue, but we can deal with it. Thank you.